So once you have fully removed the skin from the dorsal and ventral surfaces, and you've started to dissect out the superficial muscles of the back, you'll obviously see, if I can lay this back over here, that spinal trapezius really has several segments. It's very difficult to differentiate between the segments, but very much like the human trapezius, there's a cervical region, there's a region, there's kind of an intermediate region, and then there's also an inferior region. You see a lot of the same here in the muscular makeup, the muscular composition of the pig. Okay, so the spinal trapezius is going to kind of form almost like a diamond shape here, and what we've done here is we've reflected part of it to start to expose some of the deep muscles of the upper extremity. Now again, a lot of the muscle tissue is covered up by residual fascia, right? All muscles have a covering over the top of them. It's connective tissue component called fascia. And so what we'll actually see here is once we've reflected back part of spinal trapezius, this here we can identify the borders of the scapula, right? So this is the medial border of the scapula, the inferior border of the scapula, and we can actually, if we palpate or run our finger along the middle region there, we can actually feel the spine of the scapula. So the spine of the scapula is going to run right here. Inferior to that would be infraspinatus. Then superior to the spine of the scapula, just like in the human, is going to be supraspinatus. Moving back to the lower extremity, okay, or to the hind limb, again, a lot of this fat and connective tissue and fascia will be covering muscles, but one of the easier structures to identify in the lower extremity is the Achilles tendon. It's kind of a landmark structure that is going to insert just on the middle region, mid-distal region of the lower or of the hind limb, and because it's a tendon, it's going to attach muscle to bone, and it's going to be a fairly thick and prominent piece of tissue there. Okay? So, and then obviously that you will dissect out the rest of this, and we'll find the muscle belly of gastrocnemius. But this will be the continuation of the dissection of the deep muscles of the fetal pig. The IT band, and it's going to come down, insert on the lateral aspect of the knee in the human. Then, just deep to that, okay, we're going to see the, I'm going to have to move it back a little bit, but just deep to that, we're going to see rectus femoris here, the main quadricep muscle. Okay, but this is exactly what I want to see as far as when you're dissecting out the muscles. I know this can be a very tedious process, but they're really doing a fantastic job here, kind of identifying the different borders of the muscles. And then, are you using the dissecting needle or the dull-ended probe?
The needle, the hooking needle.
Yeah, are you using this or are you using the other?
When I go along the side of it, I use that, and then to go gentler, I use that.
Good, very good. But this is what we want to see, especially in the upper extremity, and then obviously down here in the lower extremity as well. And you're going to find once you start to reflect back some of those tissues, you'll be able to see, some of the deeper muscles. In this case, like rectus femoris. Okay. All right. Technique that you're going to be able to use as far as dissection of the upper extremity and the lower extremity is, again, we see a lot of this muscle fascia covering these underlying muscles. So what you're going to be able to do, and what would probably be one of the most effective techniques, is if you can use the forceps to grab a small piece of fascia and lift it up enough to make a small incision. And then you're going to take your scissors. This technique is called poking and spreading. You're going to poke in with the scissors and then open the scissors so it spreads apart some of the tissue. And so I'm just going to continue doing that, clipping some of that away, and you will start to see be able to see some of the underlying muscles. Right, so just by removing a section of that fascia, I can start to see some of these lateral muscles of the upper extremity, and we'll continue to move forward with identification of these muscles. Another one there. Okay, so this group has successfully dissected out the superficial muscles and then reflected the superficial muscles of the neck and the cervical region and part of the upper extremity to expose here the borders of the scapula. So we have, again, the medial border of the scapula, the inferior border of the scapula, and then once these muscles have been dissected out, obviously we see here is the spine of the scapula. The inferior to that is going to be infraspinatus there. Superior to that is going to be supraspinatus, and then just medial is going to be rhomboideus capitis. But this is a great example of what this particular dissection should look like. Again, we have the scapula, we have the medial border of the scapula here, the inferior border of the scapula here, the spine of the scapula, and then infraspinatus inferior to it, and then supraspinatus superior to it, and then just medial is going to be rhomboideus capitis.
Going.
Yep. All right. Here we have a very well dissected hind limb. You can see that once we get underneath the overlying muscle fascia, that we can get to a lot of the musculature in the hind limb. Here, obviously, tibialis anterior, and then we have our two peroneal muscles, peroneus longus here, and peroneus brevis, and then again, we have posteriorly, we have the Achilles tendon, which will then, as we move more proximal, become the muscle belly of gastrocnemius, and then deep to that is the soleus group. So the gastroc-soleus group in humans, the soleus is always deep to gastroc. Here's soleus right here. Then you can also see, which is quite interesting, that the extensor muscles of the posterior chain of the pig has to be significantly stronger than the anterior chain. In other words, the muscles of the posterior compartments have to be stronger than the muscles of the anterior compartments because they're predominantly toe walkers. And so they're usually constantly in the plantar flexed position. And so here you can see the extensor muscles of the anterior hind limb, which are very thin and are not, obviously are not very dense tissues. And then just moving further up, or more proximal here, we can see that we've dissected out the knee joint, and we clear away some of this, some of this other connective tissue. But here we see the patellar groove of the femur, and then here obviously is the patella. So, and we've cut the patellar tendon to expose this. But superiorly, the patella is attached to rectus femoris and the quadriceps muscles by the quadriceps tendon, so that when tension is placed on this, it glides back and forth through that patellar groove. And so when in humans, when injury can occur in which that patella can slide outside of the patellar groove, if it slides out and slides back in for a brief period of time, it's called a subluxation. If it fully comes out and does not reduce spontaneously, it's called a dislocation. But this is humans have this as well, and this structure is called the patellar groove. If we continue to dissect out the joint, we would probably be able to see some of the ligamentous structures in the internal capsule of the joint.
All right.